Hey, thanks for tuning in for another episode. Dr. Mark Testa here. I'm here with my friend Clark Lagemann, who has got an awesome program that we're going to let him talk about. We have seen on LinkedIn and in the benefit broker advisor community a lot of discussion about the Ozempics and Manjaros and Wegovy drugs for weight loss, which sad to say our country really needs, but comes with a very high price tag and some downsides. And you just can't take this stuff forever. And you can't shortcut biology all the time. You need behavioral change, you need education. And that's what Clark has today that he's going to talk about. We go back about 4 or 5 years, maybe longer now, with a fasting program we were both involved in. And I saw that he had an amazing coaching program working with these drugs. And so I wanted to bring him on because I like sharing just good information that I think can benefit people's health. So, Clark, thanks for being here. Good to see you again. It's been a while. Tell us more about yourself and your company, Avidon Health.
So it's been a decade-long journey, and it's centered on a topic you started with. We want to see people get healthier. We don't want them to rely necessarily on pharmacologic agents. So our business was founded in a physician's practice in northern New Jersey. The whole idea was the physicians said, we are trying to help these patients. We don't want to just provide them another script and send them out the door. What can we do to reverse that traditional thread of how healthcare is delivered? I have 10 minutes with a patient. I got to get them out the door. Here's a prescription, come back and see me at 30, 60, 90 days later. Just the cycle.
Yeah.
So what we did in that practice was we integrated a health coaching model. So as the patient started to be discharged, they were paired up with a health coach to work really on what were the risk factors they were identified by the practice, and then what are the behaviors they're really trying to bring to light and to work on. And then over time, we saw that was a very successful program. And it kind of grew from there. And it went from just working at physician's practice to small employers in northern New Jersey, to much larger employers, to large municipalities, to national employers. And now we're servicing the small employers to large employers, and even some of the large payers out there as well, with tools that leverage a behavior change approach through digital coaching. Everything through fully automated digital resources that drive engagement with a product, all the way through to real people that make real connections like this and help people change their lives. So it's been a fun journey. I'm excited. I'm now currently sitting as a CEO of the business.
Yeah, that's great. It's such a, I mean, you hit the nail on the head, right? The cycle just repeats itself because physicians don't have time and they write a prescription. And I've been always a big advocate of a health coach because I think people do want to change. They just maybe don't know how to change, or they don't have the support or the wherewithal to make those changes themselves. And if they can talk to a human or get some really good content that helps stimulate behavioral changes, then they can crawl, walk, run and start making the important distinctions about their health that they don't get in a 10-minute visit, and they certainly don't get in a prescription. So I love where you're going with this. Tell us what you're doing right now. I mean, you connected with me again on LinkedIn, and I know you've got an amazing coaching program around some of these weight loss drugs. I hate to just call them that because they're really diabetes drugs. And they kind of go hand in hand, really. Tell us what you
But
got
no one's
going
talking
on.
about the diabetes. No one is talking about that. Give me the weight loss. That's the sexy topic, from Oprah to, Lifetime Fitness, buying medical clinics to prescribe GLP-1s because they see it's transformative in their industries. And even, so we're recording this the end of May. I just read yesterday about Hims and Hers releasing their new version of GLP-1s, and they're forecasting, this is like going to pull me off the floor, $100 million in revenue by 2025.
Wow.
Like, this is just transformative for industries. And who isn't talking about this? And so everyone is. And who's paying the bill on this? So a lot of people, your audience, are the people that are paying the bill. And we said, we saw this, about a year ago, we saw the trends and we said, how do we do it our way? And our way is around behavior change. So everyone's going to take these medications. Awesome. They're going to see results. Awesome. but the data shows that sustainability is not there. People inevitably stop taking the medications, and typically within 12 to 18 months, weight loss has plateaued. People stop taking the medications, and Mark, surprise, surprise, within a year they gain back the weight. This is not rocket science. This goes back to the same cycle they're always on.
Yeah.
So we developed 2 behavior change courses with a coaching approach. That one helps people get prepared for taking the medications.
Oh,
So are you really ready to take those medications? If you are, here's what you should be considering. And then the second experience we have is you started taking these medications, now what? So you're seeing weight loss, what happens next? Because the person that's losing weight, it's great, maybe they're feeling better, but they're still stressed out, they're still anxious, they're not sleeping well. There's all these other conditions that hopefully we can address. So as they're seeing success, we can help them change some of the other behaviors that ultimately lead to long-term sustainable weight loss that they can manage on their own. That's our goal with these programs.
so important because we don't always eat because we're hungry.
Yeah.
Right. So if you don't get in front of some of those behaviors, why you're eating, it's just going to go right. You're going to go back to the same behaviors that got you in the boat that you're trying to get out of right now. I've never heard anyone discuss a pre-medication, even conversation around this. I'm curious. Tell me more about that.
Yeah, I mean, part of our experience, we started in a physician's practice, and we did even work with a lot of bariatric patients. And so one of the steps that a bariatric patient would have to do, they'd have to go seek counseling and take a variety of steps before, and they'd also have to lose weight before they went in for the procedure.
Mhm.
So apply that same sort of concept where there's this lack of understanding potentially, there's this nervousness that occurs, and we want the individual to be as prepared as possible to maximize the results that they seek when they start the medications, but also to start planting the seed that the medications aren't the only solution for them, that this is a great accelerator, but it's not the long-term solution. So reaching them and treating with them much earlier, we believe will help us. Again, just like the coaching model, if you build that rapport with someone much earlier on, when I ask you for taking that difficult step that you're nervous to take, you're more likely to go on that journey with me because I've established trust with you, I've built rapport, I've obviously established some credibility as well.
Yeah, that's amazing. That's great. I just never hear anyone talk about that. And I wonder if that even happens in physicians' offices. I have a feeling maybe not,
Yeah, yeah.
but that's where you're filling in the gap. Then what do you do with them with the what next phase? So they're in the program. Are you working with people while they're on the medications? Are you helping them make better meal choices and behavior choices while
Yeah,
they're
so
taking the
the
meds?
different ways clients deploy us. So an employer may say, we want you to work with 5,000 of our employees. They're scattered across the country, and we want you to just come up with a digital solution they can access 24/7.
Mhm.
So they would go through these digital coaching programs that were pre-recorded with content. They take different steps along the way, and we educate and afford them fully through digital interventions, but kind of predefined paths. And then we have other clients that say, we want people. So you and I, we are probably big believers of this. Healthcare is personal, it's human. Working with someone really matters. And we think that's the greatest accelerator to outcomes. But many clients typically are very cost sensitive. So we try to blend the two about how do we make the biggest impact? How do we steer the right ship for the organization, for the risk factors that they have? So those that work with people, they would get the benefits you're talking about right now. It's like, we're learning about you, we understand what you're going through, we're going to inform you on all the other things you start to adjust in your life to help ensure that you're getting the results, not just the results while on the medication, but really start to results, meaning behaviors that you should be doing on a day-to-day basis to get you the long-term outcomes you're looking for.
Right. How about, I'm curious because I read about some of the side effects, right, where peristalsis or movement of the food through the gut can be affected. Are you coming across some of these things, and what do you do when that happens? Because that's maybe out of the scope of health coaching.
Yeah, so you nailed it. Scope of services. So health coaches have a really refined path of what they do. Even the board certified health coaches, they're
Yeah.
great, phenomenal expertise across a lot, but they're always focused on coaching. And coaching isn't telling someone to do an activity. Coaching is coaching and guiding a conversation. We're not medical providers. So when we identify issues like that, or talk about the other side of the equation, which is mental health, stress, anxiety, depression, suicidal thoughts and tendencies. That's a topic we always discuss with our clients. Here's how our staff is prepared to address that. and here's what we do in those situations. So we're prepared, trained, and ready to identify those conditions, but also most importantly, guide that individual towards the right solution for them and make sure they get there safely.
Right. That's beautiful. You're bringing all those points up front. How are physicians receiving this when they're prescribing and they know maybe you're on the other end of this? How are they receiving your
Yeah, I
coaching?
mean, a little too early to tell for the GLP-1s. For general lifestyle change, lifestyle modification, great, because they don't have, one, the training typically. You have an expertise that many do not. Most
Right.
people don't get more than 30 minutes of a nutrition course somewhere buried into everything else within medical school. And it's
Right.
not where they're spending their time at. They don't have enough time within the office to spend with those patients. So we're a great adjunct for that for practices. As the GLP-1s kind of the surge continues, I think that many will be more forward thinking about how they want to engage their patients around this, but we haven't seen enough of a surge yet with those individual practices deploying
Right.
solutions like this.
It's interesting. I was listening to a podcast recently, Science Versus, which I don't always listen to. Have you heard that one at
No.
all? They were talking to some weight loss people, and we hear that these drugs cause muscle loss,
Mhm.
which makes sense. Now, one of the experts on there, and I didn't look up her credentials, but said really just about any diet creates about the same sort of percentage of muscle loss. I'm curious, like, how you guys are maybe addressing that. Or are you having people, try to work out, increase their protein, anything in specific around there? Because I know muscle protein synthesis requires good amounts of protein and not, 30 grams, and not always just plant-based proteins. Or
Mhm.
if you are, you need to eat a lot more of them, because it's not just the protein, it's really the constituents of protein, the amino acids, which are different in plant-based versus animal. So back to the question, what are you doing to help people, maintain muscle mass?
Yeah, I mean, what we all should be doing, which is getting and staying active. So, I mean,
Right.
our belief is the GLP, once again, great accelerators for people to see some results. We're trying to instill the behaviors that are long lasting. So, what should you be doing? Drinking enough water? You're probably not. You're probably too sedentary. You're probably eating heavily processed food. So, those are all things we address. You're not sleeping 6 to 8 hours. You're probably sleeping 5. You have all these things that are bad for you. We're addressing that. It's very intentional what we're doing, because we recognize that you will see results with these medications, but inevitably you are going to lose those results when you stop taking those medications. And employers out there don't want to spend $15,000 a year to see someone lose, gain, lose, gain, lose, gain. I mean, that's a cycle. And what do people feel? This is, I mean, you look at the psychology of a patient, and it's sad. So everyone wants the pill. They don't want the
Yeah.
shot. So when the pill comes out, maybe sign me up for GLP-1s, but everyone wants it easy. And it's no fault in them, because we can get easy fast food. We can get easy dopamine release when I get my phone in my hand. Like, this is what's skewing how we think we should live, I believe. And so we're trying to instill the behaviors that you could do a little more work and get real returns. And so we're focused on exactly that, getting active and eating the right foods and getting the right sleep. And that's ultimately our second course is around those topics right there.
Yeah, that's so important. Like, I mean, Matthew Walker's book, Why We Sleep. I mean, he goes into a plethora of details, like lack of 1 hour of sleep for men for 4 nights can
Yeah,
drop testosterone by up to 10 years difference. So,
it's
and
incredible.
glucose levels, right? That's the thing we're trying to control with these drugs to some extent, gets worse with lack of sleep. And so your point is, like, these things, there's no shortcuts, right? At all. And
There's no,
there's not. I have a 11-year-old daughter, and she was like in second grade during the pandemic, right? And we were ordering everything off Amazon. And now she
yeah,
thinks everything comes in 48 hours.
yeah.
And I grew up in the era of, and it was right in the all ads, 6 to 8
Yeah.
weeks.
Oh my
So,
gosh.
yeah, I think we've bred a culture that things are easy and fast, and you don't have to put
Yeah.
much effort into it.
Misaligning expectations. I mean, it's Yeah, it's hard. I mean, I think if I read a study recently talking about, so you talk about the age of your child, and mine are younger than yours, but with the surge of smartphone usage, the surge of stress, anxiety, depression in children through the roof. So there's a direct correlation between that, social media. There's a variety, again, kind of somewhat multifactorial, but there's this connection there, and it goes back down to what are we consuming, what are our expectations aligned against, and you can tie it all the way back to this conversation. So we look online, we look on any kind of magazine or TV, we see people that are very in shape. They have great abs. They are smiling, but they're eating a big meal. How is that possible? It's not. They don't eat
Right.
that. They work out a lot more, and they starve themselves in some capacities.
Yeah, right. No quick fix. So as people are engaged with you, I guess they can, or correct me if I'm wrong, kind of connect with you as they need it, or are you pinging people on a daily basis? And then what is the length of duration for working with your pre course and your what next course?
Yeah. So we're proactively engaging to really get people what they need and to provoke the right conversations, to provoke the right behaviors to occur. And we move as fast as they want to. So for us, and if you go back to health coaching, are they ready for change? So
Yeah,
let's assess that first. If they're ready for change, maybe the speed moves a bit quicker. If they're not ready for change, let's get them ready. Let's get them to have success. Let's get them to instill the right behaviors because we're not trying to win in 30 days. That's easy. I can win every day in 30 days. Like that's an easy race for me. Win within 3 years, that's a lot of work. So we're trying to instill those right behaviors so people have long-term health outcomes. We deliver for our clients quickly because no one says I want to pay today and have results in 3 years from now, but I want them to get a victory today, get a victory next year, get a victory the year after that. So we're kind of consistently trying to engage and drive accountability and behavior change across not just weight loss, but sleep, stress, physical activity, and everything under the sun, including substance use that
right.
impacts these organizations, the bottom line of these organizations, and also the productivity of their employees.
Yeah, exactly. Because if your culture is not healthy, or if they're out frequently or they have health issues, they're not there supporting the business in any way. So that's important.
When you
Are
think of
you?
just even bringing this into people's homes, it's
Yeah,
like if my wife eats healthy, I'm more likely to eat healthy. So can we deploy these types of solutions, which we do for our clients? It's the employee and their families. Like let's engage their families around these health and well-being topics because if you can start to have the real conversations there and people are all seeing the returns there, they're more than likely not going to have to make difficult decisions in their own home. For me, I have this big construction project going on in my house. I had to relocate to my father's house, and I go through his cabinets just to get some foods. And I'm usually at my home. I have pecans, almonds. That's my go-to snack food, junk food. I didn't have those options here. They were much worse options. And I'm like, this is hard for me. I didn't have the willpower. Like I ate all the good stuff in the cabinet that I shouldn't be eating because it was there and it was easy, it was simple, and it was at my eye line. So those are the simple things we should be doing and what our coaches typically work on. It's like there's small steps you can do that do big returns for you. Don't bring this stuff into your house. Like
exactly.
don't put it eyesight, like make it difficult to do and to grab for.
Yeah, that's true. So true. Like I'll be the self proclaimed chipaholic. I love potato chips, and I don't even eat that. My wife brings home these healthy ones. I'm like, I like Lay's.
Yeah.
That's what I
Yeah,
want.
yeah, yeah.
Can't
Give
have
it to
them in
me.
the house. Don't even bring them in. And so you're right. And I think another point you made that's super important is like if you get one person in the household, obviously it's going to be the parent to make some behavioral changes and shopping changes. It's going to ripple down to everyone. And look, you see it, I see it. The whole family could benefit and needs
Absolutely.
to have this
Yeah.
sort of training, coaching, help to make
Yeah.
the kind of changes that they
And
want.
and and even in some of those employers, they're paying the bill for the families. So
Exactly.
why are we not bringing more of these good behaviors into that household? It's a simple, easy fix that most people aren't discussing. And that's why a lot of, relying on the brokers too, they do a really good job of thinking about that, but it's always how do we get maximum return for minimal spend? And that was our journey of ours. It was high impact but high cost services. That was health coaching on site in a physician's practice. And now we're deployed against millions of lives low cost, high impact, but not as high as a person. You have a person there, you're going to get better results
Yeah.
inevitably, but it's more expensive. So it's where do you factor in and weigh those two decisions in there for the right kind of solution for the organization that you're working with.
Yeah, I love this proactive approach because I see a lot of good solutions available to employees, but some of them are reactive, right?
Mm-hmm.
They're too kind of, I don't want to say too late, but you want to be more proactive as possible. And I've talked to some employers and they're like, we don't want to get too much into telling people what to do to be healthy. And I don't think you have to tell them specifically what to do, but if you're going to pay for drugs or other services for whatever reason you decide to do that, if you can add something like this to that,
Yeah.
you're not really telling them what to do. You're not getting in their family's face. You're helping that person get the most out of that $15,000 drug you're paying for.
Yeah. I mean, so what is the culture the organization has? I mean, these employees, when they leave, they go home, they're ordering stuff on Amazon. They maybe have tried a gym, they're going to Weight Watchers, they're downloading an app, they're buying a shake. They want help. No one wants to be told to do something. I don't want to be told to do something either. Certainly not by my employer saying you have to do this. Otherwise, I'm going to ding you for your premiums or I'm going to charge you more money. That to me doesn't feel good as an employee. But if I had a trusted resource that I knew if Mark told me, hey, you have to go and talk to this person, they are experts in the space, that's great. You de-risk my whole decision-making process. And now me, am I ready for change? Hell yeah. Like, because I trust Mark and Mark just told me that this guy is the person to help me. So now I come in with an open mindset and I can actually reap the benefits and the rewards of whatever program I'm going to start. But that doesn't always happen in this sort of model that we're talking about. It's very backwards. So just trying to break the routine of how it's normally done and make a big impact for those that need it.
Yeah, love it. Well, listen, I really appreciate you taking time out of your day to help explain this. I think this is a big missing link, not only with the GLP-1 drugs, but in health care in general. So many chronic diseases are just giving a pill, which doesn't really get anything to change. Now you're paying for a pill. It might slow things down. Then you're paying for whatever else downstream. So to me, this has always been a missing piece in healthcare benefits. If the physician can't spend the time,
Yeah.
then we need to fill in the gap somewhere else. So I appreciate you,
Thank you for the
doing what you're
opportunity.
doing. Yeah. And how can people reach you? The website, what's a good way for them to connect with you?
Yeah, so certainly I'm prolific, maybe not as prolific as you are on LinkedIn, but you certainly can find me on LinkedIn and then avidonhealth.com. And through there, you can download case studies, resources, and even if you wanted to get access to preview the GLP-1 courses, we have that available for individuals that want to see if this could be a fit for their organizations.
All right, that's awesome. People, I know, like to try before they buy. So making that easy and case studies are something that employers and their advisors are frequently looking for. So you're right on the money with that one. All right. Well, thanks so much for sharing this. Thanks for tuning in. I hope this is something that can be employed if you're going to pay for these kinds of drugs, because we already know and are talking about these are short-term benefits without some lifestyle management. So reach out to Clark and his company and get the most return on your investment and help your employees be even healthier. So thanks a lot. Thanks, Clark. Good seeing you again.
See ya.